From Studio 3C in Rockefeller Center, this is News 4 New York.
A new push to keep young children healthy who are still not eligible for a COVID vaccine. This is new. Moderna saying it has a 2-shot vaccine for kids 6 months to 5 years old. The dosage is only 25% of what's given to adults. And Moderna says it's 51% effective for children up to 2 years old and 37% effective for kids ages 2 to 6. This new information coming in. Now, joining us now is Dr. Ayman El-Mohandes, Dean of the CUNY Graduate School of Public Health and Health Policy. Dr. El-Mohandes, thank you so much for joining us this hour.
Good evening, Natalie.
Good evening. Let's get to those numbers, okay? When you hear those numbers, 37 to 51% effectiveness, would you still recommend parents getting their youngest children vaccinated? What does it mean to you?
I do recommend taking the vaccine. The one thing that we need to realize is that the 37% and 51% is for kids not showing any symptoms of the disease at all. On the other hand, when they tested the vaccine, they found that the children mounted a lot of antibody response, even higher than the adults had. And that means that the kids exposed, even if they manifest the illness, it will be very mild. These high antibody levels will have a serious protective effect, and that's reassuring.
Okay, now Pfizer is expected to apply for the approval for the 3-dose vaccine for that same age group. That's supposed to happen later this spring. So we're asking here, if Moderna's approved first, should parents rush to get that one, or should they wait to see how effective Pfizer turns out till we see the studies on that one?
It's very likely that both vaccines will be approved by the FDA at the same time. The difference is that we don't know the results of the 3-shot vaccine yet. We know that the 2 shots, the Pfizer shots, the effectiveness in protecting the children was lower than the 2 shots given by Moderna results at the present moment. We don't know what the results are currently for the 3 shots, whether they are at the same level, lower or higher than what we know for Moderna. But again, indications seem to tell me that both of these vaccines will probably be looked at by the FDA more or less at the same time.
Yeah, a lot of new information coming out this spring for those younger children. All right, Dr. Ayman El-Mohandes, Dean of the CUNY Graduate School of Public Health and Health Policy. We do appreciate you joining us this hour. Thanks again.
Thank you very much.
All right.